If you ever had itchy, peeling skin between your toes, you might already know what we're talking about today: athlete's foot. It's a common and annoying condition, but the good news is it's also very treatable. In this video, we'll cover everything you need to know: what athlete's foot is, the symptoms to look out for, what puts you at risk, how it's diagnosed, and how you can treat and prevent it from coming back. Let's get started. Athlete's foot, also known by its medical name as tinea pedis, is a fungal infection that affects the skin on the feet. It's caused by a dermatophyte, a group of fungi that thrive in warm, moist environments. Despite the name, you don't have to be an athlete to get it. Anyone can be affected, and it's actually one of the most common skin infections worldwide. Athlete's foot is highly contagious and can be passed from person to person through direct skin contact or by touching contaminated surfaces like showers, locker room floors, and even shoes. The fungi can live on surfaces for a long time, and they love places that are damp and poorly ventilated. The symptoms of athlete's foot can vary from person to person, but the most classic signs are itching, burning, and stinging, especially between the toes. You might notice that the skin is red, peeling, or cracking, and in some cases it may be white and soggy looking, particularly in the spaces between the toes. The skin may also appear scaly or flaky, and some people develop small blisters or ulcers, especially if the infection becomes more severe. For some, the condition spreads to the soles of the feet or the edges, causing thickened, dry, and peeling skin, which can resemble dry skin or eczema. In rare cases, the infection can spread to the toenails, causing them to become thick, discolored, or brittle, though this is technically called onychomycosis and is treated a bit differently. Sometimes, if the skin cracks deeply, it can become painful or even infected with bacteria, which might lead to additional symptoms like redness, swelling, and pus. So now that we've covered the symptoms, you might be wondering why some people get athlete's foot while others don't. That brings us to the risk factors. The biggest risk factors for athlete's foot is exposure to warm, moist environments. Places like public swimming pools, communal showers, locker rooms, and gym floors. If you walk barefoot in these areas, the fungi can easily latch onto your feet. Wearing tight-fitting shoes, especially ones that trap heat and sweat, also creates the perfect environment for the fungus to grow. People who sweat excessively from their feet, a condition called hyperhidrosis, are more likely to develop fungal infections. Wearing the same shoes every day without giving them time to dry out can also increase your risk. Other risk factors include sharing towels, socks, or shoes with someone who has athlete's foot, as well as having a weakened immune system, diabetes, or poor circulation. These conditions can make it harder for the body to fight off infections and can also worsen symptoms. Athlete's foot is also more common in men than women and tends to occur more frequently in adults than children. But again, anyone can get it. If you're experiencing symptoms of athlete's foot, how do you know for sure what you're dealing with? That's where diagnosis comes in. Most of the time, athlete's foot can be diagnosed based on the way the skin looks and the symptoms you're describing. Doctors can often identify it with a quick physical exam. However, in some cases, especially if the rash doesn't respond to treatment or looks unusual, your doctor may do a simple test called a KOH preparation. This involves scraping a small sample of skin and examining it under the microscope with a potassium hydroxide to look for fungal elements. In rare situations, a skin culture or biopsy might be performed to rule out other skin conditions like eczema, psoriasis, or contact dermatitis, which can sometimes mimic athlete's foot. Once the diagnosis is made, the focus shifts to treatment, and the good news is most cases are easily treated with over-the-counter medications. The mainstay of treatment for athlete's foot is topical antifungal medications. These come in many forms: creams, gels, sprays, powders, and even medicated wipes. Common active ingredients include clotrimazole, terbinafine, miconazole, and tonaphtate. These medications work by killing the fungus and stopping its growth. You usually need to apply these treatments once or twice a day for at least 2 to 4 weeks, even if your symptoms go away sooner. It's important to keep treating the area for the full duration recommended, or the infection could come back. For more severe or stubborn infections, or for infections that have spread to the toenails, your doctor may prescribe oral antifungal medications like terbinafine or itraconazole. These are typically taken for several weeks and may require monitoring for side effects, especially if you have liver problems. During treatment, it's also essential to keep your feet clean and dry. Wash your feet daily with soap and water, dry them thoroughly, especially between the toes, and wear clean, dry socks. Avoid walking barefoot in public areas and rotate your shoes so that each pair has time to dry out between uses. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, to prevent athlete's foot from coming back, there are a few simple but effective habits you can adopt. First, wear breathable shoes and moisture-wicking socks. Cotton or wool socks are often better than synthetic ones, and changing your socks during the day if they get sweaty can really help. Use antifungal powders or sprays in your shoes if you're prone to infections. And remember, don't share shoes, socks, or towels with others. Fungi can live on these surfaces and easily spread. If you use a public gym, pool, or shower, always wear shower sandals or flip-flops. Keeping your feet protected in these environments goes a long way toward preventing infection. And here's something else to keep in mind. Treat your shoes as well. If your shoes have been exposed to the fungus, they can reinfect your feet. Let your shoes dry out completely between wears and consider disinfecting them with antifungal sprays or UV shoe sanitizers. Some people find that their athlete's foot keeps coming back even after treatment. If this sounds like you, it's a good idea to see a healthcare provider. Sometimes recurring athlete's foot is a sign that there's an underlying issue, like a fungal nail infection or a skin condition that hasn't been properly diagnosed. In other cases, reinfection comes from not fully eradicating the fungus from shoes, socks, or shared surfaces at home. Also, in people with diabetes, athlete's foot is more than just a nuisance. It can increase the risk of serious skin infections if cracks in the skin allow bacteria to enter. So if you have diabetes and develop any kind of foot rash or skin change, don't wait. See your doctor promptly. So, to sum things up, athlete's foot is a common fungal infection of the feet caused by organisms that love warm, moist environments. It causes itching, peeling, redness, and sometimes blistering, especially between the toes. Risk factors include sweaty feet, tight shoes, walking barefoot in communal areas, and sharing personal items. It's usually diagnosed based on appearance and treated with over-the-counter or prescription antifungal medications. Keeping your feet clean and dry, wearing breathable footwear, and avoiding contaminated surfaces can all help prevent future infections. If you catch it early and treat it properly, athlete's foot is very manageable. But don't ignore it. It can lead to complications if left untreated, especially in people with other medical conditions like diabetes. Thank you for watching. As always, take care of yourself and make the most of your day.